My name's Kate Shepherd and I'm the lead nurse for renal supportive care at King's College Hospital. I'm here to talk to Beatrice today about her decision not to pursue renal replacement therapy and instead to be managed under what we call the maximal supportive care pathway. Morning, Biddy.
Morning.
How are you today?
Not too bad today.
Okay, so I'm just going to ask you a little bit about your decisions around choosing supportive management of your kidney disease. So if I can start by asking, how long have you been under the care of the maximal supportive care?
2.5 years.
And that was after you had an admission to King's?
Yes, I was in King's for 14 weeks.
Okay. And was it at that time that people started talking to you about your kidneys not working properly?
Yes, they discussed it just before I was leaving, and I decided I wouldn't have it.
Okay. So what helped you to make your decision not to go down the dialysis pathway?
Well, they did tell me that it wouldn't prolong my life any longer. After all, I'm getting on in age, and I think I made the decision because I thought the days that I got to go, it's going to be too long, and it would stop me from doing other things that I would like to do.
Yeah. And did you speak to your family about your decision not to go down the dialysis route?
Yes, I did. And after we had a little chat, my son decided it was the best thing for me because he couldn't see me doing 3 days a week at the hospital. It would be too much.
Too much for
Yes.
you. Okay. So just as you've touched upon coming up to the hospital 3 times a week, if you had have gone down that pathway, how do you think it might have made you feel going up to the hospital for a treatment 3 times a week?
Well, to be honest, I would not be able to do all the little things I do now. I do my own little work and my own bits, crocheting bits. I think I would be too tired to do even attempt to do that.
Yeah.
So I think that would take a lot of my time.
Yeah.
Yes.
And then I was going to ask you, do you think you're missing out on anything by not having dialysis? But I think you've already answered that for me.
No, I don't think I am.
Yeah. So what kind of things do you do that dialysis may have hindered you doing?
Well, as I say, I don't go out a lot, but when I'm indoors, I like to do all sorts of little jobs and things. But I would be too tired that day after to do anything.
Yeah. And I know that you're quite involved with the other residents here.
I'm on the committee here.
You go to your coffee mornings.
I do my coffee morning.
You bake baking for them. You exercise class.
Yes, I do my cooking. Yeah. And that does take a little time, and I think that's what helps me. But as I say, if I went on that day after, I don't think I will be able to do all that.
And how are you feeling in yourself? Do you think you're feeling well as a result of not having dialysis, or do you?
No, I do feel quite well some days. Yes, I mean we all get our days, but some days I'm quite well. I really feel, you know, I can do things, which is a nice feeling at my age anyway.
And I think we've spoken, haven't we, before that, you know, when you get a little bit older, the dialysis isn't guaranteed to make you feel better.
No.
And I think with you, we've been looking after you in clinic and seeing you here at home and trying to stop you from having any symptoms as your kidney function gets worse, haven't we?
Yes. Well, you know, I think the help you've given me over the 2.5 years I've been out of hospital has been marvellous, and I don't think I could have done any better than that.
That's really nice to hear.
You know.
So do you think it's helped having the flexibility about where you have your care?
Yes, I do. It's much better than having to go to the hospital every so often, and you know.
You can get on with other things, can't you?
Yes, I can. Yes.
Okay. And I know that we've spoken. I know you're kidneys are very stable at the moment, but we have spoken in the past, haven't we, about if and when the time came where your kidneys weren't able to do their job anymore and things were starting to deteriorate. We've had conversations before about where you might like to be cared for.
Yes, and we did decide that I would like to stay at home with just care.
Yeah.
Because I like my home, and I think it would do me much better to be at home.
Yeah. And I think we've always been quite open and honest, haven't we, about wishes and preferences and planning for the future. And I think it's really important to know what your wishes and preferences are in advance, that we can avoid you being admitted to hospital, and we can have the necessary support here for you at home as and when you start to get a little bit worse.
Yes, I think that would be the best thing for me. That's what I would like.
Yeah.
Yes, very much.
And does it worry you to think about those kind of things, or?
No, I don't worry about it, because I know eventually it will come, but I don't know, when you get to my age, it's quite a bonus, really, you know. So I don't worry about those sort of things.
Good.
Really.
And I think, you know, I was going to ask you, have you any regrets about your decision not to have dialysis?
No, not at all. Not at all. No, I don't regret it.
Okay.
Actually, I like your help.
Good.
Very, very much.
Good. I'm glad we've been able to help.
Yes, you've always helped me marvellously, and I do
Thank
appreciate it.
Thank you.
Nurse, there's something I was going to ask you. If my kidney got really, really bad,
Yeah.
what sort of treatment would I get at the end?
Yeah. And that's a really good question, because we talk a lot about not having dialysis and talk about keeping you well. What we do with supportive care is we try and keep your kidney function going for as long as we possibly can. The ways we do that, as we've spoken about before, is looking at any medication, looking at your lifestyle, looking at your fluid intake, trying to keep your blood pressure well controlled. Now, over time, it's likely that the kidney function will get a little bit worse. We don't know when that will be, but as the kidney function does get worse, it may be that you develop more symptoms. At that point, we will then take a very much symptom control approach, and the whole point of that stage of your illness will be to make sure that we're treating any symptoms you've got as a result of your kidney function becoming worse than it was before. Now, there will come a time perhaps that you are entering the end stage of your life, and at that point, having the conversations that we've had before have been really important, because I know what your wishes and preferences are. I know that where possible you want to stay at home. So when you become more unwell, I will then involve other teams like the community palliative care team, who can help support your end of life care but here at home. And they would do things like have some equipment here, have more carers in to help look after you, and making sure that you've got all the right medications should you become more symptomatic at that stage.
See. Yeah, that sounds quite right for me.
And hopefully we won't have many problems with symptoms for a while, but I think the important thing for you to know is that if we can plan ahead, so we can anticipate any changes, then we can do everything that we can to meet your wishes and preferences, which is clearly what the whole point of our support is.
That's a very nice feeling for me too.
Good.